Hi, my name is Bailey Whipple, and today I will be sharing with you how to get into medical school. I once read that if you don't sacrifice for what you want will become the sacrifice. This can be especially applied to pre-medical students as they are required to keep up with a number of things throughout their undergraduate years and don't have as much time to live the typical college life that most are. In today's speech, I'm going to walk you through the numerous actions that are recommended to be taken by pre-medical students during their undergraduate years in order to get accepted into a medical school and get started on the road to becoming a doctor. A little background about myself is that I've wanted to be a doctor since the 7th grade, and I've done extensive research on the pre-medical journey since the 12th. You might be thinking, why is this important to me? Knowing this information may be beneficial for a number of reasons. One being that you're thinking about pursuing the path of medicine yourself. Another being that you'll understand what some of your fellow classmates are going through. And lastly, you'll be able to appreciate your current and future physicians a bit more, knowing the amount of hard work and determination went into the process. Today, we'll be reviewing the academic, communication, and extracurricular expectations given to pre-medical students by medical schools, or ACE. During your undergraduate years, you'll be able to major in whatever you'd like. However, medical schools require certain prerequisites to be admitted, and these prerequisites come in handy and are crucial when studying for the medical college admissions test. The Medical College Admissions Test, or MCAT, is designed to assess problem solving, critical thinking, written analysis, and knowledge of specific concepts and principles. There are 230 questions that are divided into 4 sections. It is 7.5 hours long with breaks and 6 hours and 15 minutes long without them. The CASPER is a situational judgment test. It is a type of psychological test that will present you with real hypothetical scenarios and ask what you would do when faced with a particular situation and why. Doctors of medicine and doctors of osteopathic medicine fulfill the same roles. They have similar school schedules, similar residencies, and practice in all 50 states. However, there are some differences as osteopathic doctors tend to treat the patients in a more holistic way, and they treat the patient as a whole rather than just an illness or a disease. They also focus on the body's natural ability to heal. Medical doctors focus on diagnosis and treatment of diseases. In summary, DO schools are slightly more lenient when it comes to academic scoring. However, DO schools are still extremely competitive, and it's important to do the best that you possibly can during your undergraduate to give you the best chances of acceptance. I would argue that the most important extracurricular when applying to medical school is gaining meaningful clinical experience. This helps the student get a better idea of what it's like to be a doctor. Volunteer work is also extremely important. It's important to get involved in your community. In the clinical setting, it shows that you know what you're getting yourself into and proves commitment to the medical school. And just like anything else, it helps you develop interpersonal skills such as leadership, teamwork, and communication. Communication plays a key role in establishing therapeutic relationships and acknowledging the humanity of patients. It also builds confidence and compliance in your patients. And additionally, knowing another language can help distinguish you on your application, and more importantly, connection, understanding, and empathizing with your patients. A great way to figure out if a career in medicine is the right path for you is through virtual and in-person shadowing. This will show you a doctor's typical life, and it's easier than ever since COVID brought about virtual shadowing. It's important not to lose yourself during this time and make time for things that really make you happy. Some things for me would be playing volleyball at GTCC, watching HBO, and hopefully being a part of the UNC club cheer team. Now it's application time. Time management is key, and the typical timeline is first you will submit your primary application, then your secondary, and hopefully interviews will start rolling in, which will lead to acceptances. Congratulations! Hopefully you've been accepted at this point after following all these steps, and you are overcome with joy. After all this time, hopefully you've realized how challenging and demanding this process truly is, and you're able to recognize and treat the physicians in your life with the appreciation and respect that they deserve. And just remember, to ace your application, you must first ace your undergraduate years. Thank you.